Assalamu alaikum. Welcome to Dermatology Journal scan of December 2025. Our first paper was a retrospective study examining the effect of isotretinoin treatment on the height of adolescents with acne vulgaris. The authors reported a reduction in height velocity, but eventually isotretinoin did not have an effect on final patient's height. The next article was a Delphi consensus on skincare ingredients that is recommended by expert cosmetic dermatologists for various skin conditions. Their recommendations reflected the preference of well-established and studied traditional ingredients that has stood the test of time. Here are some snippets of their recommendations. For fine lines and wrinkles, there was no recommendation for hyaluronic acid or collagen supplements. For redness, like the one associated with rosacea, green-tinted cosmetics for camouflage have been recommended. For dark spots, hydroquinone was still recommended, and for large pores, retinoids were the only recommended ingredient to be used. In the British Journal of Dermatology, Mehta et al. Compared topical Tofacitinib to topical tacrolimus in the treatment of localized non-pigmental vitiligo. Both treatments were effective, with more than 80% repigmentation in 33% of patients with Tofacitinib treatment and 20% with tacrolimus treatment. Facial lesions responded better than those on the trunk with both treatments. Adverse events were less with Tofacitinib, and response to treatment was observed earlier with Tofacitinib. The next article discussed the value of stem cells and growth factors in the treatment of chronic wounds. Mesenchymal stem cells derived from bone marrow, subcutaneous fat, or cord blood secretes important bioactive factors. Both these bioactive factors and growth factors like platelet-derived growth factor and vascular endothelial growth factors all are angiogenic, anti-inflammatory, and they also stimulate the migration and proliferation of keratinocytes and fibroblasts, thus improving the wound environment. In the Investigative Journal of Dermatology, there was 3 interesting articles. The first one showed the involvement of interferon 1 in the triggering of lichen planus. Another paper discussed the potential of glucagon-like peptide 1 receptor agonists in the future management of chronic wounds. And finally, the beneficial effect of Roflumilast in the treatment of psoriasis is thought to be through the reduction of inflammatory cytokines in CD4 positive T cells and also in neutrophil infiltration in the plaques. An article introducing the potential of CXCL9 as a marker for morphea activity and severity was published in the British Journal of Dermatology. Finally, an article in Dermatology and Therapy Journal discussed the possible favorable effects of the anti-IL-17, anti-IL and anti-IL-23s on atherosclerosis in patients with psoriasis.